This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin helps to thin and loosen mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan acts on a part of the brain to reduce the urge to cough. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking children's Giltuss cough chest 10 mg, 100 mg/5 ml oral liquid expectorants, it's important to follow the instructions provided by your doctor or on the product packaging. It can be taken with or without food, and it's important to stay hydrated by drinking plenty of fluids to help break up mucus and clear congestion. The dosage of this medication will depend on your age, medical condition, and how you respond to the treatment, so it's important not to increase your dose or take it more often than directed. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device and avoid using a household spoon. For powder packets, empty the entire contents onto your tongue and swallow, and for capsules, swallow them whole to avoid a bitter taste. It's crucial to use this medication properly and not to abuse it, as it can lead to serious harm, such as brain damage, seizures, or even death. If your cough returns or is accompanied by certain symptoms like a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, be sure to consult your doctor, as these could be signs of a serious medical problem. If you suspect a serious medical issue, seek medical help immediately. Some possible side effects of children's Giltuss cough chest 10 mg, 100 mg/5 ml oral liquid expectorants include dizziness, drowsiness, nausea, and vomiting. If any of these effects last or get worse, notify your doctor or pharmacist promptly. It's important to remember that if your doctor has directed you to use this medication, they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed above, it's important to contact your doctor or pharmacist for further guidance. Before giving this medication to your child, make sure to inform your doctor or pharmacist if they are allergic to Guaifenesin or Dextromethorphan, or if they have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist before use. Also, be sure to let your doctor or pharmacist know about your child's medical history, especially if they have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness. Using alcohol or marijuana can increase these effects, so it's important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also advisable. If your child has diabetes, liver disease, or any other condition that requires them to limit or avoid sugar and/or alcohol, it's important to use this product with caution. Additionally, if the medication contains aspartame, it's important to consult your doctor or pharmacist if your child has phenylketonuria, PKU, or any other condition that requires them to restrict their intake of aspartame. Before your child undergoes surgery, be sure to inform the doctor or dentist about all the products they are using, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with a doctor. It is also unknown if Guaifenesin or Dextromethorphan passes into breast milk, so consulting a doctor before breastfeeding is recommended. When taking children's Giltuss cough chest oral liquid expectorants, it's important to be aware of potential drug interactions. Certain medications may affect how this expectorant works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It's important to also be cautious with other medications that contain guaifenesin or dextromethorphan, as taking multiple products with these ingredients can lead to consuming too much. Additionally, guaifenesin may interfere with certain lab tests, so it's essential to inform the lab personnel and your doctors that you are taking this medication. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. It's important to follow your doctor's instructions and not share this medication with others. Make sure to attend all medical and lab appointments as well. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing children's Giltuss cough chest 10 mg, 100 mg/5 ml oral liquid expectorants, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and do not freeze the liquid forms of this medication. Different brands may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When it comes to discarding this product, make sure to not flush it down the toilet or pour it into a drain unless instructed to do so. Properly dispose of it when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.